Welcome to the Boldest You podcast. I'm your host, Carrie, and I'm thrilled to bring you real conversations with bold women and men. In this podcast, we dive deep into their stories, exploring what drives their courage, shapes their vision, and fuels their desire to leave a lasting impact. These are honest, vulnerable, and inspiring moments that celebrate what it means to be bold. Let's discover their legacies together. I'd like to introduce you to our bold woman of the hour, Meghan Bennett. Meghan is a clinician and researcher in the field of clinical psychology and currently finishing her PhD. Her work focuses on understanding and treating the negative impacts of traumatic experiences on people's lives. Her relationships are what make a life most meaningful for her, and if she could, she would spend most days outside, in the sun, and near the water. Meghan joins us for a special edition of the Boldest You podcast as we celebrate Mental Health Awareness Month this May. Mental health is such an important topic, and the more that we can learn and grow, the more that we can accept and welcome our own stories. So with that, welcome Meghan. Let's get into it. Hi Meghan, it's so great to have you on the podcast today.
Hey, thanks for having me.
Awesome. Well, May is Mental Health Awareness Month, and so we're going to talk about mental health. We know it can be hard to talk about that at times, but you clearly have experience in this area. So, can you just start out by sharing a little bit more about yourself, your background, and why you decided to pursue a career in the mental health space?
Definitely. So I guess kind of starting with my interest in the mental health space, actually started when I was really young. I had a classmate who lost their parent to suicide, and I
Mm.
really just had a lot of questions as a fourth grader, kind of like, why does this happen? What's going on? A lot of curiosity about that, which led to kind of pursuing psychology later on. And that curiosity is what's really kept me going in this profession. So I actually initially thought I wanted to be a full-time clinician. And so I got a master's degree in clinical counseling and then was working with patients. And then through that work and kind of getting to know people's stories, I was at the time working with neurofeedback, which is just a fancy way of saying we're looking at kind of how the brain impacts what's going on, what people are showing up with. And I found through my conversations with patients that there's a lot of kind of like, what's wrong with me? Why am I crazy? Like, is it all in my head, or a lot of self-blame? And I just found that being able to provide some of the biological context for why we experience the world and ourselves in the ways that we do was really helpful in providing some movement for patients. And so that got me really interested in kind of how stress and trauma in particular get under the skin to impact our symptoms, impact how we experience the world, and led me back to school to get my PhD to be able to actually research those things. So my research really focuses on kind of the underlying biology of trauma, and my clinical work, I'd say, is pretty focused with trauma as well. And so I'm currently finishing up my last year. So right now I'm seeing patients. So I've done research the past 4 or 5 years. Right now I'm seeing patients full time. And then from here, I'll go into kind of a blended research and patient facing space. So.
Wow, so fascinating. And how interesting that at that young age, being able to take a really hard experience for your classmate, and I'm sure those around them, to be able to, yeah, eventually find your future career path. I think so many of us, when we're at that age, are probably listing all these things that we want to be and probably do not become those things. I know I did not become a pediatrician,
Yeah.
very opposite. But how fascinating to have that curiosity at that age and to be able to continue that just as you grew up. And what you were talking about, your field of study, that's so interesting. I've never thought about that, of how it could be helpful for someone when you can explain more, like you said, the biological things that are happening in our brains. And that it's, yeah, we're not crazy, that there's actually reasoning behind how we're feeling, or the different things that are happening. And so as you've gone through that, all this training and research and so much of what you just explained, I'd love to hear just why you think it's so important for people like yourselves to study those things. Mental health in general is so important to talk about, I think, but especially for people like yourself that are researching those topics. Why is it so important that we have people like you doing that work?
Yeah, it's a good question. Um, yeah, so mental health is obviously so important, and ties in with more, right, like the outcomes of one person's mental health. It impacts their own life individually, but you can think of all the ripple effects of that too. So think of kind of a dyad where mom is depressed and or dad is depressed, and then raising their young child, for example, who then might not get some of the regulation that they need. And then we think about kind of the ways that mental health is tied in with physical health, with the way that we just relate and interact in the world. And so, yeah, mental health, and in the capacity that I work is I'm working with individuals. So I don't work with families or couples, but we look at it at the individual level, but we can see how it's tied in with everything else, and really far reaching. And I think kind of using the research and going through training in particular is really important, because we can then kind of find ways to make treatment better, and we can help get,
Mm.
like, better supports out there for people. So like it feels good for all of us to have someone listen to us and to validate us. Um, and that's really wonderful, but it can't really stop there, right? If you're just going to therapy and it's just kind of a venting session, or what I call fire of the week, and you're here, someone's listening and they're validating you, like that feels good, but is it really leading to the changes that are going to be meaningful for your life long term, for the ways you relate to the world? And so the more research we do, the more we can understand what's going on for people, how things are showing up, what are the mechanisms that really maintain that, and then use that
Mm.
information to say, how do we target that with particular kind of evidence-based interventions in treatment?
So interesting. Yes, I remember, I think it was just last year, my therapist, I know I was mentioning before we hopped on that I've been in therapy for years. And she was like, I think you're ready to graduate therapy. And I was like, wait, what? Like that,
Yeah.
what? And she's like, yes, Carrie, the goal is not that you have to come forever. It's that you've learned the tools and skills to be able to work through these things. And I was like, oh, I guess that makes sense. But yes, so as you were talking about just different treatments and methods. I would love to hear your experiences of different types of treatments that are out there. I think when we think of mental health or mental illness, like talk therapy is probably the main one that people think of. But I'd be curious to hear just different things that you've been working with or experiencing in your work.
Yeah. Yeah, I think talk therapy is a big one, and talk therapy can really can be very meaningful. And within talk therapy, there's kind of a lot of directions you can go. So there's lots of different therapy modalities out there in the talk therapy space, and there's also people from a lot of different training backgrounds who provide those services. And so I think it's important to kind of think about what's kind of going on for you that's leading you to want to seek therapy, and looking for kind of that match there. And I have, yeah, thoughts and opinions on how to kind of go about that process. But in addition to therapy, right, so there's like psychiatric medication, and we know that, so you think of like your antidepressants, medication that people might take for anxiety or for helping regulate mood with bipolar disorder. And there's at least like some evidence out there to suggest that actually pairing those things together, so using psychiatric medication in combination with talk therapy, can lead to better outcomes at times than using either alone.
Mm.
Um, there's some people who really benefit also just from one or the other. And then kind of other treatments that I have some background in. I think I mentioned the neurofeedback, or EEG biofeedback. So kind of looking at what's going on in the brain and how that's kind of impacting how you're showing up. And also HRV biofeedback, which is heart rate variability, which is really looking at
Mm.
how we can actually change our breathing to help us regulate our mood. So if I say, Carrie, like, just be less stressed, just like start producing less cortisol, just turn off your cortisol response right now. You're like, what? I can't automatically control my hormones, right? Like those are the stress response process happening all the time. But by accessing our breath, that's actually one way that we can immediately kind of tune into that parasympathetic nervous system. So kind of our rest or digest, kind of helping us regulate. So it's something we're doing all the time, but we can also manipulate extremely easily by just changing our breathing, which is why people intuitively, take deep breaths or whatever it may be when they're feeling anxious. And then I also think like physical, especially, so I mentioned my interest is in particular in trauma. And so especially types of kind of adjunct modalities like yoga, for example, or things that are kind of swimming, things that are helping connect you with your
Mm.
body, right? Because when we cut off from our emotions, we cut off from our body, right? Our emotions are generated in
Mhm.
the body. And so even walking, running, if we can incorporate some of those physical pieces that help us get back into our body too, I think those are really helpful. Uh,
Yeah,
yeah.
there's so much there that when we talk about mental health, right, I think you mentioned the physical piece of it too, that it truly is all intertwined. We can't just say we're going to focus just on our physical health or just on our mental health, or we can't just focus on one of those things, even though it feels like when we're really going through it, it's like, okay, well, I'm just going to put everything to the side and I'm going to focus on this one simple thing. But as you just explained, it's all so interconnected. And so, as you mentioned, yes, with the focus on trauma and stress, I'm just curious from the different people that you've seen over your years of clinician time, what are things that you see people commonly deal with, especially when it comes to the concept of this podcast being bold. As we were talking about before I hopped on, I think mental health and being bold have so much interlapping, just because to do that, to take a bold step, we really have to know ourselves. And so with all your time in this field, what are those some common things that you see people really struggling with when it comes to their mental health or that willing to take the next step?
Yeah. Yeah, it's a good question. I think one is just barrier to kind of even starting therapy in the first place. So there's a really common notion I hear all the time of like, well, I should have just been able to get over this. I should mention I work with adults. So especially, thinking about things that have happened a long time ago. Well, like I am an adult now. Why am I not over this? Or I should have been
Mm.
able to handle this on my own. Or my problem's not big enough, right? Like I like nothing, like not like one like particular like horrible event ever happened to me, like I like it's not kind of big enough for therapy, like I don't really maybe even deserve to be in this space, or like I'm a burden for being in this space.
Mm.
um so I'd say those are things that come up a lot as just kind of like barriers to even getting started. And my response to that would be like quite the actually think it takes an incredible amount of boldness to start therapy. Right? If you're showing up to that space, you're showing up because there's some part of you that's interested in change, and change is extremely difficult and scary. And it's one of the scary parts about being a human, right? So I think there's an inherent boldness in deciding to show up. And then, there's, for all sorts of reasons, it's difficult for us to be vulnerable. It's difficult for us to be
Mm.
authentic. It's difficult for us to sit with our own internal experiences of our own emotions and our own thoughts. Um, and so that can make it hard to be bold, right, in outside of the therapy space, because if you're not connected with that, it's hard to be kind of connected with yourself. And so we need to kind of look to others for maybe cues or validations, or it's hard to kind of understand, well, who am I really in this? And
Mm.
then throw in some, you know, difficult life circumstances or difficult relationships that have made it hard to really have maybe the space growing up that somebody needed to be able to identify, like have their own identity and self. And so those are the things I'd say I really, yeah, see showing up a lot.
Isn't it crazy how we talk about comparison culture? I feel like that comes up a lot on this podcast of we even do that with the things we struggle with of like, oh, well, it's not as bad as someone else's struggles, so therefore I don't deserve this help. It's like are we ever going to stop comparing ourselves to everyone else? And I certainly know I've done it. And I've had weeks where I go into therapy and I'm driving on my way there and I go, I don't really think I have anything big enough to talk about this week. And conversation starts, and what do you know, all of a sudden I have things that I'm processing, and maybe it's something from years ago, weeks ago, yesterday. But there's, yes, as soon as we can let that barrier down of, no, I deserve to take up the space in this room, I deserve to have these conversations, I deserve to focus on myself. I think that's something I also, as a person who, like, relationships are really important to me, and I know you mentioned in your bio that those are really important to you too, and so we can feed into other people so much, and I got to take care of those people and forget that, oh, I'm supposed to do that for me too. Like, it's important to do both. um, so yes, I think everything you just mentioned is really relatable for people. Now I want to talk about, you mentioned it's really hard for people to take that first step of, how do you explore, okay, I finally have admitted I want to try some sort of treatment.
Mhm.
But I think even if you do a quick Google search, it can be really overwhelming about where to start. So
Yeah.
I would love your advice of, if someone's at that place where they're ready to take that first step, where do they go? What are those baby steps that they could take to start exploring getting treatment?
Yeah, I love that question. And I'll start actually like with maybe a question before that, that to kind of break down those barriers. So you mentioned like, oh, I thought like, wait, I maybe would be in therapy forever. And I think that's really like a major misconception that people have
Mm,
because, and it makes sense. That's how it's portrayed in the movies, right? Like that's how we see it. It's like, well, you're in therapy for life. So I guess I'd start by saying, if you're on the fence about trying therapy, give it a try, treat it like an experiment, and you don't need to stay in it forever.
mm,
I have a lot of people who I make like a lot of good work with in under a year and they're ready to graduate. So I think there's this idea, if I commit, I'm committing for a long term. And so I think if we can take that off the table, it takes a little bit of the pressure off to say, let me try this out and see if it could be helpful.
mm,
Um, and so Right. And then kind of once you make that decision, the modal number of therapy sessions is one. So once people get in, they usually do one session, most people, and they don't go back. This can be for a variety of reasons. But I'll say that therapy, like any profession, there are bad therapists out there. And
mm,
so, right, because there's that power dynamic, the sense is, well, there must be something wrong with me, or like I'm not ready, or just like therapy isn't for me, when at the end of the day, you really just had a bad experience with a therapist who wasn't a good match for you for whatever reason. And so I'd say to not get discouraged with that and to also not be afraid to break up with your therapist and find somebody else if you need to. So then how do we find them? So yeah, I think with this, there's a lot of things to consider. So if you're going to do insurance or if you're going to do self pay, so most people are going to want to go the insurance route because it's more cost effective. And so if you're going that route, your first thing you're looking up, most people are saying, who takes my insurance? And then if I want to go in person, who's closest to me? That's what they're going to kind of put in. But how do we narrow those search terms and actually understand how to get connected? So Psychology Today, if you just type in Psychology Today and click on that, it'll take you to a website where you can actually start putting in a lot of filters. So you can filter by your insurance, you can filter by people who are taking new patients, if in person or virtual, and then you can start kind of selecting issues. So
mm,
you might have something in particular you're going for. Like, I'm feeling really, really sad, really depressed. I just can't get out of this funk. I feel so stuck. You might choose to kind of click depression then. Or, like, I really want to improve my relationship with food. I feel like there's disordered eating. You might choose somebody with that specialty. Um, and so you can actually kind of check off boxes regarding what you're wanting particular support in. And here's where, when you're searching, this is where I would be cognizant of looking at someone's profile, because if somebody says they're an expert in everything, they're not. So it's kind of a red flag if someone's like, yes, I can do all of these things. Not to say, many therapists, we are skilled in many different areas, but I really look for someone who, like at mood and trauma is my specialty, which covers a lot, but it's still narrowed down, right? I'm going to make referrals out if people are coming in with things outside of that scope. Um, And so I kind of look at that. And then I think the other thing that's difficult to understand and navigate online is there's so many acronyms. It's like, what's an LPC? What's an LSW?
Mm-hmm.
What's a psychologist versus a therapist? Like, I don't really get the differences. So just to kind of like broadly break that down. So my training initially was as a master's level clinician, and now I've gone back for my PhD. So somebody to be a psychologist, to have that as your title, means that you've earned a doctorate. So that can be a PhD, which is a doctorate of philosophy. It's going to be more research based, or a PsyD, a doctorate of psychology. Both of those training programs are going to be, this means these people have gone through 5+ years of training. And through that entire time, we're working with patients. They were getting supervision, right? I've had sessions recorded, watch that tape back. You're also doing research. You're in a lot of intensive training throughout your whole time. And there's lots of checks and balances you have to go through. So I'm, evaluated every quarter by multiple people. It's a pretty strenuous process.
Yeah, sounds like it.
That's what that psychologist distinction is. It means it's somebody who's gone through doctorate level training, which is typically 5+ years. Then you're going to have people who are master's level clinicians. So this is what I said I initially went to school for. These programs are usually 2 years. And during the second year, you're doing that therapy work and getting that supervision. And then you graduate. And you can graduate with different kinds of training. So your LPC you'll see on there. If you're someone who wants an individual therapist, that stands for licensed professional counselor. And that person, if you're going with master's level, is probably going to be a good fit for you. Then you'll see people LSW, licensed social worker. So the training there is a little bit different, where it takes more of a system level approach. And so this is going to be better if you're looking for, like couples therapy, for example, or or kind of what you're presenting with is more of like relational, kind of more systems level things.
Sure.
And then marriage and family therapist is another kind of training that if like specifically you're interested in couples, that might be the route that you want to go. So we see all of those acronyms pop up, and I think it's helpful to know that training programs do differ. And so kind of thinking about what are my needs and whose kind of background might be the best fit in terms of qualification for that. So any master's level clinician or psychologist also needs to go through examinations and licensure by the state. So that's all different than somebody who is a life coach, for example. So those you'll also see on the internet, or people kind of starting their own things. The regulations are totally different for that, and you don't need any kind of set of kind of like regulated training. That's a different category, but it sometimes gets like mixed in the pool with all that.
No, very interesting. It was the question I was going to ask, certainly, because yeah, when you start to look at all those things, the numbers and letters and all, it can all become jumbled, and you're like, what does all of this mean? And so it's so fascinating to hear just the breakdown in the training levels and all that goes into it, truly. And I liked what you said around that in this field, yes, there's maybe some bad apples, and there might just be people who approach doesn't work for you. I know in my years of therapy, I think I've gone to 4 different therapists, and I think when I was going to the first 3, I was like, yeah, this is fine. And I didn't realize until my fourth one, who specializes in Brene Brown's curriculum, which I really relate to, that I was like, wow, like I'm learning so much more. And it had nothing to do with those therapists not being good, not being qualified, not being trained, but it was just the approach that I needed and the specialty that I needed to help me process some of the issues that I was experiencing. And that has been something when I talk to friends that are interested or curious about, like, your first therapist that you talk to may not be the one that you stay with for long term. Or, like you said, you might go for one session and go, this is not what this is not helpful. And that's okay. It's definitely normal to test out a few. It's kind of like flavors of ice cream. Like I love mint chocolate chip, but not everyone does, and that's okay. And so it's just finding the right fit for you. I'm so glad that you highlighted that. And that was a question when you talked about the life coach, because I think when we're on social media is amazing to stay connected to people and really challenging these days, I think. And I think there's so much messaging about mental health on social media. Like every account, it seems to be, if they're an influencer, like they're talking about it in some way. And so, what recommendations would you have, like if you're going through your social media feed, to be able to kind of wade out maybe some of the not true messaging or the messaging, like where do we focus our attention on social media so that it's not feeding into the things that we're already struggling with? Oh, it's a loaded question, but
Oh, that's a good, yeah, that's a good question. Yeah, I mean, you're right. What we consume impacts us so much. Yeah. I think your question's kind of like how do we kind of like determine like real science from pseudoscience or
yes, that's a much more eloquent way of asking the question that I asked.
um, yeah, I think yeah, and there's a lot of so I guess I'd start by just saying, like, as humans, it's normal to experience a full range of emotions, a full range of kind of problems. And so when we look at things that people come to, like a major depressive disorder, for example, or obsessive compulsive disorder, for example, like these are also kind of like to get diagnoses, you're kind of going at certain thresholds. So, like, a lot of us are going to experience a lot of these symptoms as just humans, um, which is different than maybe something meeting diagnostic criteria for something.
Mhm.
And so I think like part we can just normalize that, like, yeah, part of this is just our experience as humans. And then, like, based on kind of what you're needing, what are the supports that I need right now? What would be helpful for me? And that may or may not look similar to what we see on our feeds of what might be suggested to us, right? And I think, like, especially here in the United States and in a lot of kind of westernized cultures, a lot of kind of what we see show up on there from influencers or whatever it might be is like this very like hyper individualized approach of like self-care, like I'm gonna make like my like I'm taking my like smoothie supplements in the morning, and then I'm like I got my sunshine and I got my walk, and like, which sunshines and walks are like really great for you. It's not like those are bad
Yeah.
things, right? But we kind of have like this template that if I follow like these steps to kind of do this and I stay hydrated, I'll be good. And those can be helpful, but a lot of us actually need more supports than that. And also a lot of healing actually happens in relationships. So
Mm,
we are talking about fit, and that's a big part of it is that you're not, when you go to therapy, you're not just kind of getting a set of tools. You're actually like forming a relationship with someone and relating in a new way. And kind of the ruptures and repair in that relationship can really help us learn and be in a new way too. And
mm,
so this kind of like I think a lot of the hyper individualism that we see in social media feeds can sometimes derail us from the places that we could even get more support and healing, which might be through relationships, whether that's with a therapist or whether that's connecting more with people in our community or organizations that matter to us and getting involved in that way. um, so yeah. I'll pause there.
yeah. No, I think that's a really good call out that with social media so much these days. I remember when I first joined social media, which was probably in like late elementary school, junior high when it came around. And it really was just about staying connected to your friends. You'd post the pictures of like at the football game on the Friday night and overly edited with like the crazy editing. Like it wasn't the editing that it is now, but it really was about I'm connected to my friends and what are my friends doing. And I think that's the big shift that we see now is it's the influencer, or it's looking at these examples of people's lives that it's really easy to go, okay, yeah, like you said, they did these 5 steps. Now they are quote unquote better. So if
Yeah,
I do those exact same things, I'm going to be better. I know
right,
I have fallen into that trap, right? Especially with gym workouts of, oh, I don't know what I'm supposed to do when I go to the gym. So if I do those 5 exact things, like perfect. And that's not realistic. I'm a completely different person than that account. And so I think it's a great call out to recognize that when we're on social media, like certain parts of that person's journey may work for us, but we still need to explore our own things that we need. And I think the other piece that you mentioned around that diagnosis, I think sometimes when I remember when I first started therapy, like I almost was, it was a reason that I almost didn't want to pursue it. I didn't want to get the diagnosis of anxiety, of I definitely knew that there were pieces of me, but I was like, oh, like there's such a stigma around that. But then actually getting that was really validating and helped me be able to process it deeper. And so I think that's maybe something as we talk about what holds people back too, of
Yeah.
just going to therapy doesn't mean that you are going to get diagnosed. Like there's a lot of reasons that you make, or you said some of those things are just really natural human emotions that you still need to process and get support through. But on the flip side, like if it does lead to a formal diagnosis, that could also be really helpful in making sure you have the right tools to help you through those things. And like you said, the medication, if you get to that point of needing that extra assistance. So there's, I think you brought up a really good point in the sense of when it comes to diagnoses as well, that we might see that on social media, but just because you have the same behaviors or things, it doesn't mean that that's exactly it. It could just mean that these are normal human emotions, and it's important to talk about those things too.
Right. Yeah, definitely. And that's like and a diagnosis is something, it's helpful for from the provider standpoint, one, to bill insurance,
Mm,
and two, to communicate with other professionals, right? If you can kind of, we have kind of a working framework of that. Um, and I always see people as people first, right? So a diagnosis is helpful for our conceptualization and our framework. It's helpful for research and evidence. And there's a lot of value, like you said, just as receiving it, a lot of validation that can come from that too. And right, we like, or I think most therapists, right, will view that in the context of like you as a larger person and
mhm.
being first. Yeah, definitely.
Absolutely. Well, I know we've been talking about a lot of things, and we talked about like actually how to seek treatment and those things. The other thing that I think is good to talk about, especially Mental Health Awareness Month, and mental health, as I've always heard it, it's a spectrum. Like you don't have mental health or not have mental health. Like we all have it.
Right.
We're all just at different points with it. And so maybe there are, people are not dealing with things that are to a point where they need to seek formal treatment or that extra support. But what are ways that all of us can just prioritize our mental health in our day to day? Some of those simple things that we can just keep top of mind, regardless of where we're at on that spectrum.
Yeah, I love that question. I think this is something I see all the time too. We have this notion of like healed or unhealed, right? Like,
Hmm.
and then when we're talking about social media, like, okay, well, I just need to like, I just need to regulate, or I just need to do, right? And it's like,
Yes.
well, first off, the world is a scary place to be and live. And so sometimes, right, what you're experiencing isn't some this pathological thing that needs to be regulated. It's actually like really important emotions that you're feeling dysregulated. What in your environment is cueing you to that, and what actions
Mm,
like might that be calling you to do? And so I think like a simple shift in our day to day is changing some of the ways that we maybe view or interact even with our emotions. So, um, people usually view like my bad emotions. I just want to feel less. Here are the things: angry, sad, loneliness. What else do people hate? Shame, guilt, embarrassment, anxiety, right? All of those things. And I want to feel more happy, joy, um, peace, calm. These are the things that people like. And so I think if we can kind of like back up for a second and view that we don't have good emotions and bad emotions, but that all emotions are helpful cues that our body, our brain, our mind is giving us that are potentially helpful in prompting behaviors and actions that might be effective for us, that might add to a valuable and meaningful life. It can change kind of the sum of the ways that we view those. So most of us will try to avoid the ones that we think are bad. And we do this in a lot of ways, but the common ones are like distracting ourselves, opting out of things, so just kind of withdrawing, thinking strategies like ruminating or worrying, substances like alcohol or food, whatever it might be. And so And that makes sense. That's like what most people tell us to do. They're like, get over it, just stop it. But I think if we can kind of go back to like that purpose and value of each emotion and treat those also as our allies, as things that can help
Mm.
us. So I think like anger is a really good example. People hate anger. And it's a lot of times because it's what we do when we're angry. It's like who I've yelled at my partner out of anger and just like said something I regret. I feel guilty afterwards. I'm like, oh, right. It makes sense about anger, bad. No, it's actually that I engaged in behaviors that weren't aligned with my values. It's not that the
Mm.
emotion was bad. Like think of a world where we don't experience anger. That's a really scary place to be, right? We would
Yeah.
never have social justice. We never stand up for people. We never stand up for ourselves when boundaries are being violated. Anger is really activating and it's really helpful. Same thing with fear, right? There's famous case studies of the part of your brain, the amygdala, that does a lot with fear, where there's been lesions, and if you don't experience fear, you get in a lot of dangerous situations, right? Fear helps keep us safe. So inherently, our emotions aren't this thing that's like good or bad or thing that needs to be like controlled or regulated. I think when we get stuck into that kind of control agenda, it's where we kind of end up leading, feeling more disconnected, unsure of ourselves, all of those things. So I think in day to day, if we can start, when you experience emotion, maybe ask like, what might this emotion trying to be telling me right now, right?
Mm.
And we can do that by start even just like acknowledging what is the emotion, because so many of us have been trained to like as soon as an uncomfortable one comes up, like, oh, gotta shut it down, right? So if we can actually take that curiosity and kind of just look at the emotion from a curious way of like, wonder what this is about. And actually in a moment where usually you would go to distract, to make yourself feel better right away, like pause and maybe give a minute to actually sit with that. And it's going to be uncomfortable, and that's okay. Being uncomfortable is part of it's part of what we sign up for, right? We're not robots yet. So I think just letting ourselves kind of experience that is a good starting.
Yeah, absolutely. Makes me think of Inside Out 2. Like those movies, if you've seen them.
Yeah.
Um, I remember watching those movies and I'm just like, oh, they got it right. Like, yes, even anxiety, like that's an emotion I know I feel a lot and I can want to push it away and just be like, no, don't want this. Like, this is the worst thing I've ever experienced. But I've really learned sometimes it can also be my superpower of it helps me um, identify like maybe why am I feeling this way, like what's coming up that is causing this anxiousness. So yes, I love what you said. It's important, all emotions are there. We're not robots and that's a good thing, we don't want to be. And so just important to have it all. And I think the power of a pause. I know I've said that on this podcast before, but taking a pause when we're feeling those ways and allowing ourselves to process in the moment versus just automatically say, "Oh, nope, not supposed to feel that way. Move on. What can I do?" So that's really practical advice. I love that. Well, as we're nearing the end of our time together, and at first, just want to say thank you so much for all your expertise. I am learning so much in this episode, so I'm sure others are going to as well. I love to end with just some rapid fire questions. They're totally unrelated, but just kind of ended on a fun note. And so, what is your beverage of choice? What's going to be on your desk throughout the day or in your hand when you're out and about?
This is, I feel, a joke. I don't know if this is like across a lot of therapists, but that we always have like four drinks at a time. So mine are always water, sparkling water, and then a coffee.
Amazing. I love that you have the plain water and the sparkling water. You got to have
Gotta mix
both.
it up.
Oh, so good. And as we've talked today and a lot about taking care of ourselves, what would you say is your favorite way to unwind?
Um, yeah, I'd say like making a really yummy, nutritious, comforting meal, and
Mm.
then watching an episode of something that's like more light, or yeah, because I just went through like a Schitt's Creek binge.
So good.
Rewatched that, but yeah, kind of like at the end of the day, just like having some of that alone time to do that.
I think almost everyone on this podcast has said something about like a TV show, reality TV. Like, yeah, I think we all just love those episodes that can make us laugh or just make us kind of wind down from the day, get away from the reality of it a little bit. I love that. And yes, what you said about a nutritious meal or like a good comfort meal, that's the best part after a long day of just, oh, this meal's gonna like warm my soul.
Yes, yes. And then depending on energy level, I'll try to get out for a run. I thought I hated running. It turns out I
Mm,
just don't like running fast or competing. But
fair.
I realized just like using it as because I spend most of my day inside. And I'm just like viewing it as this is my time outside alone and I can go really slow and almost use it as kind of a mindfulness practice has been really helpful too.
Yes, I people ask me if I run and I'm like, I jog. Like
Right.
I
Right. You
don't
can walk faster than I'm running,
for
but
sure.
the
Yes.
motions are there. Yeah.
Yep. My husband and I are signed up for a 10K and he is way taller than I am, naturally just more athletic. And I was like, yeah, you like I'll be way behind you. I'll just see you at the finish line. Like I'm just out there for a good time. I'm not out there to win.
Yes.
Yeah, and same with what you said of like discovering those things of even like an audiobook. Like I thought when I ran I had to listen to music and then discovering like, oh, I actually kind of like this is a good time to listen to one of my favorite books. What?
Yeah.
Like it doesn't have to be like this horrible experience. Like I can enjoy this. But yeah,
Yeah.
important to find those things for ourselves for sure.
Definitely.
And then to go on more of a gratitude note, what is something that you're grateful for today?
I'm really today, I mean, a lot, but I guess like today in particular, I'm really thankful for um I'd say my fiance just our was like
Mm.
feeling really stressed the past few days and I just like had a really good conversation where he really helped kind of like ground and reorient me to um kind of like really what matters. So yeah, it's really helpful. I'm really thankful for those relationships to, um, yeah, for that support.
Oh, those people are the best in
Yeah.
those moments. My husband and I have a game. We actually learned it from one of our friends of like real or unreal, like realistic or unrealistic. Like when I'm starting to spiral, and he'll be like, "Okay, Carrie, like, is this like, where are we at here?" And it's just enough to trick my brain into going, "You're right. Like, come back to earth, be centered." Yes, those people are so great to have in our lives. And on the topic of people in your life, if you could eavesdrop on your friends talking about you, what would you want to hear them saying?
Ooh, wow, this actually happened to me recently where I was on a FaceTime call with two of my friends, and for some reason, my audio, like they couldn't hear me. And so they didn't
Oh, you really did live this out in real life.
work this out in real life and I realized I have like the best most supportive friends they were yeah they were like I really want like Megan to feel just like calm and joyful. They were talking about planning a bachelorette party.
So
And I
fun.
was like, you guys I was like why are they talking about me like I'm not here. And so it's actually like and then I got the audio figured out and I told them I was like I could hear you but it was so um it was so special for me to hear like how supportive they are.
Yeah.
So yeah, it was a weird but fun experience.
That is, yeah, very unique, but hey, sometimes we need that. It's hard to listen to those things about ourselves, but if you can put yourself in that situation unintentionally, yeah. And as someone who works with a friend of yours, I can promise you that she talks very positively about you, or we probably would not be having this conversation right now. So, and then lastly, as we didn't really talk about boldness in the sense of like we usually do with this podcast, but part about being bold is the legacy that we're going to leave behind. So as you think about the legacy that you would want, what would you say is that legacy you want to leave behind?
Yeah. So I have another friend who's in she's a medical doctor and we were talking about this one time. We're both interested in research and basically human suffering and how do we kind of heal and treat. And just like this picture of, like little corners of the world, like if we can all kind of like contribute to our work in these ways that feel and science is really slow. Research is really slow. Like builds over time, right? But like, can I make some contributions, I guess, like in a little corner of the world that I'm at to like help us all be more compassionate, right, to ourselves, to other people, to just like have like a little bit of improvement in like this little space. And so, yeah, I think that's kind of the legacy I'd want to leave, that in, and we all, everybody has different gifts, different expertise, different ways that they show up. And so if I can use in my space of psychology and research, if I can make just little tiny changes that can kind of help improve our treatments, also help
Mm.
improve our understanding of ourselves, normalize our experiences as humans, right? Let people know that like they're not broken, all of that good stuff, and just in that small little space, that would be a great legacy.
Amazing. That is such a great answer. And I think all the time and effort you've been putting into your field is certainly going to help you get there. So, Megan, thank you for your time today. It was so fascinating and just allowed us to be a little bit more open about mental health and have these conversations. I know our listeners are really going to appreciate it. So, to everyone listening, thank you for listening to another episode. And I just hope that you, until next time, continue to be bold. Thanks again, Megan.
Thanks, Carrie.